Everybody, I'm going to bring this Health and Human Services Committee meeting to order. It is October 15, 2024, and 3:45 p.m. We'll start our day off with DSS. Commissioner Gibson.
Hi, Bob.
Hey, Bob.
Hey, Bob.
How are you?
Hello, Bob.
Welcome, Bob. Nice to see you.
Well, I'll be nice and quick here.
There we go.
A couple of requests of the contract. You would have received the list, right, Ken?
It's attached. Oops, sorry.
So, this is the time of year we send our agreements down in mass, so that everybody can see contracts that we've had for years that we do keep planning to continue. So we look for a resolution just to do those in mass. So that's my first request.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And my second is to request authorization to enter into agreement with Greater Hudson Promise Neighborhood. They do training for people who work in shelters overnight, and they're going to training the warming center folks.
And you're also going to be having a ribbon cutting, so to speak, or a open house?
Thursday at noon.
Thursday noon? All right.
So who's getting trained?
Do I have a second?
Second.
Further discussion?
Yeah,
Who's getting trained?
So the staff that's been hired by Mental Health Association to run the place will be getting.
And about how many people is that?
I think that it's 7 people, and please don't hold me to that.
For operational hours, 24/7.
Yes.
Okay, from November to March. Temperature wise, it's temperature based, right?
You would say so.
Okay,
You would say so.
okay,
But it's open
It seems like it-
first.
okay,
We close it at the end of the week.
okay.
Good
So we have a motion in a second.
All in favor?
Aye.
Opposed? Carried.
So don't forget to come by on Thursday.
Yeah.
We'll have some good, they're excited at the church as well, but this is a Dornquist church. We're excited there as well. We'll give you a tour of the place and,
Look forward to it, Bob. Thank you.
Okay?
Been a long time
Homeless numbers are up a little bit.
They're gonna keep it.
All right, thank you, Commissioner.
Thank you.
Director Grandinetti, we do have a resolution here.
Hi, Dan.
How's everyone?
We're good.
Yes, just looking to pass one resolution, ask the chairman to allow us to accept a $25,000 swim grant for the.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you so much for doing this.
You like money coming?
Yeah,
I said, I know, I was
will
gonna
sign
say
it.
combination.
Yeah, perfect. I liked it better when it was a Chatham and Hudson applying for that.
Yeah.
Feel like a mama bird regurgitating. for a living.
But it's, those are all times of now, far back.
Okay, up next, Victoria, excuse me, Director Victoria.
Hello? How's everybody?
I'm good over here.
Good.
Yeah.
It's sparkly, it seems today.
We
I
are.
like it. All right,
Where's Kathy?
a couple resolutions. First, authorization to reappoint 2 members of the Columbia County Board of Health,
Move it.
Dr. Osborne.
Second.
Yeah.
Further discussion? I will say they're very good contributors and pleasure to be on board with.
Yep.
All in favor?
Aye.
Opposed? Carried.
And then authorization to renew annual contracts.
Move it.
Have a second?
Same as last year.
Still looking for a second.
Second,
Further discussion? All in favor?
Aye.
Opposed? Carried.
And requesting authorization to renew annual contracts for grant funding.
Move it.
Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And authorization to renew affiliation agreements with colleges and universities.
Move it.
I'll second it, but I have one question. Is there a reason the Columbia Green Community College is not there? Don't they have a nursing program?
They do, and we do work with them, but they don't necessarily come to us in the RN program. which is what the college has. These often are nurses seeking a bachelor's degree, which do have a public health component, which does require us to have an affiliation agreement.
I think I remember though, that part of the issue in terms of increasing the enrollment at Columbia Green was the lack of opportunities for them to participate for practical experience. And so I'm wondering if we could enter an agreement, if that would be helpful to them.
We do work very closely with them. We just don't have an official agreement. But we can, I can reach
Just a
out.
thought.
Sure. They do shadow us, like, I mean, for the COVID pods, they were with us constantly. And they'll come by. It's just, they don't have the requirement that a bachelor's degree does. But I will
Just love
reach out.
to do whatever we can do to support them.
Absolutely.
Keep them here.
Yeah.
Exactly.
Exactly.
Yes. Yes.
All in favor?
Agreed.
Aye.
Opposed? Carried.
That's a whole nother story.
Authorization to contract with speech language pathologists for early intervention and preschool services.
Move it. Second.
Further discussion? All in favor?
Aye.
Opposed? Carried.
Authorization, for the health department and to enter into a data use agreement with New York State Department of Health for access to Biospatial, a web-based platform to provide insights into EMS data.
Can you translate that?
Sure.
Yeah.
So Biospatial is like a analytics platform that would allow us to view certain metrics that EMS data reports. So like we would be able to see state and national trends and performance benchmarks, biosurveillance, substance abuse and overdose trends, COVID tracking, and inter-facility transfer analysis. So it's all things that EMS agencies report to the state, and then the state would share that information with us. And the data use agreement part is largely our agreement to protect that data, destroy it when we're done with it, kind of thing.
So is this new data that we've not been able to access previously?
So the details of it, yes, many counties, this is brand new stuff to them. We do work very well with our EMS agencies in Columbia County, so a lot of these things we are aware of and we do know about. This platform, of course, is brand new and will be able to provide graphics and things that we wouldn't necessarily have access to.
So you're
Better
just-
the
pie
ti- or the
charts, Rob
time to-
Lopez.
Right. So fancy pictures and
So
stuff.
you're supplementing or expanding your insight.
Yes, definitely.
I'll move it.
Second. Further discussion? All in favor?
Aye.
Opposed? Carried.
And then my director's report. Any questions about anything there from anybody?
When is that's tomorrow is the public hearing for the
Yes. Yep, for the local sanitary
sanitary.
code,
code.
10 to 12 at Columbia. They do, and it looks like that across the board. They took a bit of a nosedive, so hopefully it stays that way. And flu and RSV is low, but it's still early for those. We're hopeful that.
I was surprised at the vaccination numbers that 98% of people in the country have had some form of immunization. That seemed very high.
Yeah.
Certainly higher than.
But that includes actually getting sick. and-
Probably,
Right, yeah.
yeah.
Yeah,
But I-
saying
Okay,
you got
so
that.
So really, it's 100%.
Explains the
I
gap.
can't think of it at the Board of Health, and I can't think of it again, the term that they use.
Herd immunity?
No, like any kind of exposure to either to an infection or a vaccine. I think I said wisdom, but I don't think it's it. COVID wisdom or COVID, there's a word. And I couldn't remember it then, and I don't remember it now. I will get that.
Google it.
Yeah, I'll have to.
Google it in the morning.
Yeah.
Yeah.
In my head, yeah.
All right, any further questions from the committee for the Department of Health?
Thank you.
Thank you very
Thank
much.
you so much.
Sir?
We need to be called upon. Good afternoon, everybody.
Hello.
Just a total of 4 financial resolutions today.
First of which asks for your authority to support an increase in the opioid abatement dollars that the Department of Human Services has on hand at any given time. You may remember, those of you that were here last month, I had JP Cahill, our dual recovery coordinator, speak about the opioid flex funds and the various ways in which they've been used throughout the county. This is a pot of money that supports those flex funds. We like to have money on hand so that money orders can be generated and we can pay people's rent, security, things like that.
I'll move it.
Second.
I have one question.
Yes.
How will that affect the overall budget pot for this? Do you have a budget line or pot for
We
this?
do. I allocate $50,000 of the 2024 opioid abatement dollars towards the Flex Fund program. So all this is going to do is a slightly larger amount in-house to work with. We've been noticing a dramatic uptick in people requesting assistance with rent and security. So that gobbles up the $3,000 quite quickly. So we felt if we just brought it up a tick to 5,000, we'd be able to be a bit more nimble before that pot was replenished through the county's process of getting the money replenished through the controller's office.
So it's about access, not it's budget neutral.
Yes.
Okay, thank you.
All in favor?
Aye.
Opposed? Carried.
Thank you for your support. Financial resolution number 2 is with regard to Twin County Recovery Services. Most of you may know that Twin County Recovery Services is our one and only outpatient substance use disorder provider. They have been having a particularly difficult time recruiting, workforce issues. They have 3 significant clinical vacancies that they've been trying to hire for an extended period of time. I met with Karen O'Brien and Keith Stack from Twin County Recovery Services to problem solve and discuss how the local governmental unit might be able to help. And short-term help would be in the form of what you see in front of you, which is a suggested $12,000 to give to these 3 positions, which may be 4 positions actually, as a sign-on bonus. This was very helpful to the outpatient mental health center back when the New York State Office of Mental Health gave us money to offer to incentivize hiring and things like that. We did something very similar, and we were able to land several employees this way. So I ask for your support. I'm suggesting that we use federal salary share dollars, which we have a significant balance of at this time, to do this. And this is well within the parameters of the federal salary share dollars and how they should be used.
So it's going to be divided equally amongst 3 or 4 people?
Yes, I recently learned there may be a 4th position that needs this support. When I met with Karen O'Brien and Keith Stack, there was 3 positions that they were challenged with, all 3 of which were clinical positions. Besides their clinical director, they only have, well, it's changed. They had 1 credentialed alcoholism and substance abuse counselor doing the clinical work at Twin County's Columbia County at the time. That's not enough.
So when, I just had a quick question about this. When they do the sign-on bonuses, do they have to be there a certain amount of time to get it?
Yes.
Yeah, okay.
They're going to mimic what we did at the county, which was we dispensed the amount over 4 quarters, so over a year.
Perfect.
All right.
Thank you. I'll move it.
Do I have a second? Okay. Further discussion? All in favor?
Aye.
Opposed? Carried.
Third financial resolution is pretty straightforward. We're asking for your support to adjust the 2024 budget to include an increase in state aid for the Columbia Green Mental Health Association. So this came in after we submitted our budget.
We're adding money.
Yeah,
Do I have a second?
I had to hear it again.
Did you send it?
He made the motion.
Oh,
No.
I'll do
All right.
whatever's left.
Motion on that, second on
So where's it coming from?
The state. And it's going to be passed on to the Columbia Green Mental Health Association.
I got that.
All in favor?
Aye.
Opposed? Carried.
And the last resolution is just requesting your support to receive the next round, the 2025 round of opioid abatement dollars to the tune of, what does it say there?
119,158. I'll hold it.
Further discussion? All in favor?
Aye.
Opposed? Carried.
That's all I have.
Do we expend the annual allotment for each year? Do we fully expend it, or is there a balance in that account?
Yes, we expend it, but technically there's a balance because the point at which we contract with several individuals varies.
Mhm.
So it's kind of a moving start and end date to their contracts, but yes, all of 2024 is spoken for. You may remember we did RFPs. People USA has responded. I'll be meeting with them tomorrow. Actually, they'll be joining us for the opioid work group that we have with regard to the class action lawsuit, the county's opioid settlement dollars. They're going to be joining us for that because they bring with them some marketing talent. And at this point in those conversations, I need their help in that regard.
Before we leave on the subject of substance abuse, Commissioner Gibson and Director Brandon and I and a few others sat in on Cheryl Roberts' talk a couple weeks ago about the using of PET scans to show metabolic activity in the brain and what it does with different substances. And I thought it was extraordinary. And maybe we could work on this committee seeing that eventually. And Dr. Dewey. Fantastic.
We
It
had
was
a
an
call the other day.
extraordinary presentation.
I'm glad you appreciated it, Chairman. I think it was well received. I unfortunately was not able to be there. We had out of town guests come in, but I've heard nothing but good things about Dr. Dewey's presentation. We're looking to have him back. We had a call, when was it, last week, right? About how to plan for that and how to get it to even more people. I understand the attendance was good, but we really want to target it to get maybe the schools better involved and just get that message out to people. Because I understand you went way beyond just substance use disorders into screening time and the impact of all of that as well.
Video games on dopamine, which is pretty interesting.
Yeah.
All right, so thank you for being out ahead of that. I look forward to that. It was an extraordinary
Yeah, I have
presentation.
conflict as well. I'd love to see that.
Thank you.
All right,
everybody.
thank you, Director. Last but not least, Office of the Agent.
Hello. I feel like that was the fastest we've ever gone, and now
Now you're on the hot seat.
I'm gonna slow us all down, but I'm gonna try not to. Okay, to start out, we have a resolution to continue participating in the Everhome Columbia pilot and thus amending the contract with the Everhome consultant through December 31st, 2024. The Home for the Aged and New York State has agreed to continue through the end of this year. I don't know what happens January 1 as of yet, but we will keep you updated. I have a meeting with the Home for the Aged tomorrow, which has been a long time coming. As you know, I was out of town last month and then sick, and I feel like I haven't caught up on anything since. So finally getting into that meeting tomorrow. We'll get to my quarterly report to give some updates there and probably answer more questions on that topic. What's the balance we got funded?
I want to, from the state, 120,000 left, I think, from the state.
And that would be in play in terms of if we haven't drawn it down by December 31st. We might no longer have access to it.
I have received nothing in writing, but verbal confirmation from Fred Olson, Executive Director of NYSOPA, that if that money is not used completely for this program, it will go to the OFA to be used otherwise. I see.
To which
The county.
the county,
Yes, sorry,
Okay.
to us.
Okay.
Um,
So we won't lose it, it'll just be repurposed.
right.
That's good news. That might be even better news, actually.
There have been lots and lots of meetings between myself and the Everhome home group. Lots of conversation. Not a whole lot of action, I would say.
unfortunately. I think in order to see this become what it really could be, if it were to be moved into 2025, I think there's a lot that needs to be done. And from
Very short time.
now to December, now listen, we all know I'm excited and I'm a go-getter, but like even I don't know if we can get all of what needs to be done in the next 2 months, so we will see. One of the top things on that list from now before to December is a letter going out to all participants with a predicted what their cost would be if the subsidy were to end, because whether it does or does not, we don't know, but they need to have it. They need to have it. Right.
And I couldn't quite understand your graph in your report. How many people have we helped or have been helped by this pilot?
So 91. I don't think I had the number for this
It's
quarter.
here.
So quarter 3, we're down to 36.
Yeah, why don't we address the resolution at
report.
hand and then we'll talk about that. So do I have a motion to continue through to December 31st?
Motion.
Second.
Any discussion? All in favor?
Aye.
Opposed? Carried.
Thank you.
That was in seconds.
Next resolution is just to dispose of 2 vehicles that are
We're good. Second.
ready to.
Further discussion? All in favor?
Aye.
Opposed? Carried.
All right, so thank you. Quarter 3 report. If you, I sent it to you in a weird.
You know,
Well,
it's actually
Yeah, you
like
got
a
it like
legal
this.
size, legal size document.
sorry about
Actually,
that.
she does it on like that. But we did. That's why I didn't understand it.
Yeah.
Well, the graph on the right just matches all of the numbers on the left. It just, I'm a visual person, so I like colors and things. So to jump right down to Everhome, they are down to 36 tablets out in the community as of this quarter. So that the number has gone down. I forget, what was the most recent question?
How many
people
we
helped?
have served in total?
Yes, so 91 total. Well, sorry.
36 active.
Right.
This is 91 active this year. So overall, I don't think we ever went above 50 tablets throughout the entire, out at one time throughout the entire pilot. But overall, I don't know if I have that exact number. I definitely.
Original predictions were to be hundreds by now.
Right, I think they ordered 400 tablets. And I don't know that we ever broke 50
Right.
in the pilot. Now, and I think we've talked
That's a
about.
good idea.
this. Oh, yeah, there's tons of potential here. There's tons of potential, but I think there's a lot of, things that need to be tweaked and pivoted a little bit, and, follow up. I think we could use more of that.
So what's the issue?
All around.
Is it staff? Is it the actual
Yes.
leadership, the management of this whole thing?
I think there's
Because this has been going on for at least 2 years.
quite
Longer than that.
a few.
When did the pilot start?
2022, I believe, so.
So we might have started
2024
talking about it in
is-
2021 or, but I mean, they did have a change in some of the leadership, I think, but I
The
don't
team
think
has
that's ever.
changed a couple times on their side. I have a big presentation to bring to HFA tomorrow. A lot of questions of my own, I don't know what the specific, expectations are from, Home for the Aged. I don't know what the specific, reporting requirements that they're looking for are. I would love to know what those are because I would also like to see that information. I really haven't seen a ton of data anywhere ever, and I've asked a lot for it. Now, I'm not a numbers person, as you can see, the way my stuff's sent you the graph. But I think, if you're trying to point out that we're keeping seniors out of the emergency department,
Or nursing homes in general.
right, which is a goal, right?
Right.
That's what everybody wants to do.
Show us
And
the
they say
numbers.
that that's happening, but I don't know how you know it's happening. I don't know the methods or techniques you're using to measure this. I also think in the beginning of the pilot, which we may have talked about in previous meetings, in the beginning of the pilot, it was really focused on that tablet piece itself. And I think that this program, and this is just talks with them, talks with my team, talks with people using it. I think the program really needs to be more focused on the caregiver and more the app rather than the actual tablet. Because if you go through just a little bit of information that we have collected, I don't know if you'll recall, my team and I put together a survey to go out to users, I don't know, back in May, I think we probably put that together. It was, to my knowledge, never sent out. I still haven't seen results if it was sent out on their end. That information, you know, the little bit that we have gathered from conversations with with clients and things like that, it's mostly people just using the tablet for the calendar feature or maybe the video chat feature, which is great, super helpful things, right? But that's not keeping them.
That's not what was presented. It had nothing to do with the tablet. It had something to do with the tablet, but it was a full,
The tablet.
it was a camera system that was going to tell if somebody fell and if somebody moved wrong. And
Yeah.
it was a completely
Now,
a
those
different
things-
thing that was presented to us.
Those
I think it's a
features
classic,
exist.
you know, concept that was a great concept that the rollout is for.
Yeah,
And, you know, but it's not what was presented. I mean, I was very involved in the beginning of this.
Mm-hmm.
It was way more of a technical thing. You know, the person would hit a button and speak to a nurse at the hospital. And that was what was presented. And then it turned into a tablet. Well, you know, so.
right. The
Anyway.
groundwork is there. I think,
Are the original investors still involved?
I believe so. I believe engaged and so far.
You mean
Hero.
Hero. Lou
Here,
Hero,
yeah, Lou
right.
Hero. Is he still
I
involved?
think
Yeah.
this was it failed to deliver on a number of levels. The first was marketing. We talked
Yeah.
about getting
You
the
said the
caregivers.
rollout.
The rollout was abysmal.
Mhm.
And then I think the capacity, the ability to deliver the services in a timely way. I had a couple of people that called over and over and over again and never got the calls returned. And so they just said, what kind of care is this? I mean, they haven't even gotten their first call back. So,
So they were gonna have X amount of non-payers,
right.
which should have been easy, right? And I don't think they would fill that gap.
I think
Then there
that
was gonna be,
50.
then there was a centerpiece to that where they would pay something.
Mhm.
And then there was a full pay piece to that, but
So
Yeah,
it's
it's supporting
never, none of that ever.
So this eventually supposed to be self-supporting too.
And they're branching in other demographics.
Yes, exactly.
over the next, you know, what are we in October, over the next 2 months or so, I've worked with them on some plans, you know, right now they're down to one care coordinator, so one staff on their end to do kind of that heavy case management piece. And, they have their tech guy, doing the bi-weekly calls for check-ins. And I said, hey, you know, first of all, we have a consultant here. Why don't we utilize her? Let's just take a step back and look at trying to make this a little more efficient and effective, right? So, we have the Blooming Health automated messaging system within OFA that we don't pay for, and our is funding that right now. So we have a plan to start using that system for those bi-weekly check-ins. So that way it's not, you know, we just take 15 minutes or so, put it into the system. And then that's not taking manpower when you only have one care coordinator. That doesn't require a person to do, right? And then we just go in and check the responses if people want to talk to somebody. Simple yes or no question. We can have our consultant follow up. So looking at tightening up a few things, seeing kind of what, you know, there's actions on both sides of this partnership that can be taken, and I don't see everybody following through on everything. And I get it. There's a lot of pieces to work on, a lot of things that are also on everyone's plates, but I don't know.
Just one more point here. OFA, our OFA wasn't the ones that were supposed to be taking the majority lead.
That's right.
Yeah.
So.
We were gonna make
I
referrals.
mean, I know you came on later, but this was supposed to be a program that was run by them.
Yeah.
And that OFA was supporting it and was in favor of it and was happy to see it happen. But we weren't the ones that were supposed to be doing the heavy lifting.
Right.
And
Now it
so
sounds like
that
it's
was
turning into a
never-
program that we
it was
may
never,
manage, you know.
ever.
Well, we have hired
Right.
this year.
Yeah.
But that's out of that.
Linda, I don't have the numbers with me, but I printed out just kind of the year to date and then from program start to now, kind of how much she's done, just
Oh, yeah.
to look at. And she's also kind of morphed into, you know, her role being more of that care coordination and case management, rather than just promotion.
She's the reason we have the numbers we have.
Sure. Because we had nothing to go with.
Exactly.
So what, do you know why the loss of 7 1/4?
A few people passed away.
Okay.
One person, I believe, moved out of state. I'm missing 3 people passed, one moved, a couple were just no longer interested. I would say I don't think marketing has really been happening over, you know, the last couple of months. I think especially because this original meeting to determine funding from HFA was supposed to happen in June, I believe, and didn't happen until just a couple weeks ago.
And now we're playing catch up with something that ended in September.
Right. So we'll see. I definitely, it kind of kills me a little bit to pull back. You know, having all these meetings, coming up with all these ideas, I would push farther and do more work, but like you said, it's not our baby. We're working with the account.
Well, in all fairness, I'm not sure no matter what you do,
Yeah.
it'll make a difference. anymore.
Right.
You know, if the core group that's doing this doesn't have to shit.
So everything you've done is why they have what we have.
It's just not gonna add.
They're not holding up their end of the bargain.
I still think, I agree with Nina. I think this is a great idea. It just wasn't well executed. I still think it could would work.
I think
There's
there's a
proper
lot of
leadership.
potential. Yeah, a lot of potential. I think tech is one of the big, could use tweaks there. And you know, I've had all this conversation with them too. The tablet itself, I don't think is the best fit. The focus needs to be more on the app than the tablet.
And graphical user interface is
Yeah.
difficult to.
You know,
I know.
I think if it's tweaked, it's focuses on caregiver, that's what that service is for. You know, they compare to save money, keeping somebody at home versus going into a nursing home or a skilled nursing facility or, it definitely, you're saving money here, but this system is not going to be there to help you take a shower. You know, it has to work in conjunction with other programs. I don't know, it's a shame, but we'll, yeah, I'll let you know how tomorrow goes. I think there's a lot of potential there, I do. And if it, you know, starts to turn around, I have tons of ideas for next step. We will see. And then just some updates for you. We've got some anticipated community education and engagement coming up. November is home care and hospice month, so we'll be blasting out a lot of information there, giving a shout out to our personal care aides because they're fantastic. We're working with the Alzheimer's Association to get a caregiver series in place, which I think will be super helpful to, you know, a lot of the residents in the county. Looking to do an intergenerational game night with Taconic Senior Network. And if you haven't checked out Taconic Senior Network, they're fantastic. They're kind of a new up and coming senior club in the area. Recent events, we had our 5th annual Senior Day on September 12th. A shout out to Supervisors Eldridge and Collins for attending and not for speaking and hanging out with adorable puppies. If you haven't seen photos, check out our Facebook page. I almost left with one of those dogs. It was very close. It was a record-breaking year. We had 234 seniors in attendance, 23 vendors. We raised nearly $1,000 to be split between Columbia Green Humane Society, which was our guest of honor, and our Senior Stars program, which is that emergency assistance and holiday program. And along with that money we raised, or, you know, there was just heaps of dog food, cat food, toys, pet beds and things like that. It was very cool to see. We held a volunteer ice cream party for the day habilitation groups that run our home delivered meals routes. Stockport Community Day, we were at attendance where we were supposed to do Ghent Community Day, but I was sick as a dog, so I had to pull out. Healthcare Food Service Worker Week, we were celebrating the kitchen last week. This week we've got Case Management Week, so we're giving a shout out to all of our case managers that do a ton of work. October 23rd, we've got a memory mixer coming up down by the waterfront, again for caregivers and their loved ones. Looking to do Veterans Thanksgiving meals again this November. We're thinking 35 or 40 is going to be the number there. We're going to start planning our Senior Stars holiday deliveries. Senior community centers, so Valatia and Hudson, I have two meetings. I had a meeting today with the mayor of Valatia, Evans, to talk about potentially bringing the Valatia site back to the, what is it, Valatia Community Center, the original site, to, you know, we were there pre-COVID, we only moved because of that 6-foot rule. This would mean we wouldn't have to pay rent at the church, St. Luke's Church anymore, so we'd be saving some money there. The village? Village of Valatia, really wants us back, to kind of coordinate on programming and things like that. So it sounds really positive. Stay tuned for a resolution next month. And then Friday, 10/18, I'm going to be meeting with the mayor of Hudson to talk about something similar going on with the Hudson site. Our contract there, I believe, ends in December. So hopefully looking for a little bit less in rent, or maybe coming up with some happy medium, to save money across the board. It would be ideal. Again, stay tuned. Personnel, we've got 3 interviews scheduled for that nutrition services coordinator position, and we are in the process of creating a contract with a new registered dietitian who already works within the county and also worked for NYSOFA at one point. So I think that'll be very, very helpful there. Open enrollment has begun, and it's also heat season, so my office is insane. If you plan to visit, wear a helmet. We're running around crazy. Pretty much all I work.
So we had talked earlier when we first came out about coming to the town board meeting. Where's that?
To be honest, haven't scheduled any of those, but have hit a ton of community days. So I thought it was kind of a little bit of both there, but town board meetings. Now those are all
Evenings.
right.
Maybe you could do a combination, but I just, you know, it was one of the things that we had discussed when you were hired, because some of our towns just, it would be nice. It doesn't have to be you. I mean, you could send a representative from the office of the agent.
Cleared.
Well, I prefer it to, but
Evenings, probably not gonna get somebody well, but
whatever, but I'd like to see somebody come out, do a presentation to our board. It doesn't have to be all of them. Maybe we can combine with another town, just to kind of talk to our community and say, these are the programs that we offer, what we have. I mean, a lot of times these towns that are outside of the city of Hudson don't really know. We can leave all the brochures you want on the table, but it would be I think would be a really nice thing to just have you come out one night. It could be 20 minutes.
Yeah.
Just to say, you know, hey, we're Office of the Aging, these are the programs we have, we're here to help, blah, 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 blah. But I really would like to see that happen. I know you're busy, maybe it could happen after the new year, but just, I want to make sure it still stays on your.
that also
Target.
reminds me, is it January typically that letters for the advisory council would go out in the past? To send out to
Because we have a lot of openings in the advisory council.
I was gonna say, you know, in past, Rob, I have had sometimes good delegates that attend these meetings and bring that news to a town board meeting, and they're enthusiastic. Right now, I don't have that, but you know, that has worked for me in the past sometimes, but.
We just created a form at the that would have been September meeting, I think. We don't meet until next one, but we just kind of created a form as a group for what we're looking for advisory council members
Okay.
to bring to the
Yeah.
advisory council meetings from their towns, and then what they bring from. the
As we all
meetings
know, it's getting the right person.
back
You
to
know.
the town.
I think maybe
I didn't know what the
report
term
was this month.
And then meeting with them.
The Greenfield seniors.
There's a very good possibility
I
it's on that
think you're
calendar.
at the, yeah, I think you're meeting with them, because it would be better to meet the Greenfield senior group than, because my town board meeting is, you know, not.
I know it's Lewis
Yeah.
and these days.
Yep, that, so,
Yes. I know Lewis comes to advisory council every month.
so, yeah. Yeah.
Quick
You are,
question
you
about
are
your
meeting
data
with them.
presentation. So your data presentation,
Yeah.
what are the other columns? Is this chart wizard playing tricks on you, or see how you've got
She says it should
5
be
and
all
6
these
columns?
numbers.
It's all these numbers here.
Yeah.
So case management would be client served, right? Case management in quarter 1, which is the blue column, 197 clients served. Quarter two, which is the orange column, 183 clients served. Quarter three, gray column, 195 clients served. Does that make sense?
Yeah, you just have quarter three. You have two quarter threes.
And also Everhome looks like it's just under 200. You know what I'm confused about? Yours doesn't look like mine. Well, this is what came with the submission. And
It's
that's
okay, we
what's
can
up here.
iron that out. Maybe it's just a little bit of a.
So maybe it just reformatted. I can resend that email.
All right, are there any questions for, Dr. Benvenuto?
So I have two questions. One is, the heat numbers, I see now that's a cumulative, you've given us a quarter. So that's the number of applications you process each quarter for heat assistance? Yeah,
This is the client surge. That would be the number of applications, which is keep the seasonal. So
Okay.
it went way up. So
well, I
far
was trying to
this year.
match this with Bob's numbers, which look really consistent, but I'll ask Bob that question. So the other question is, the advisory council, we had at least
They
one,
handle
maybe,
heat since we pulled out cheaters.
okay. We had at least one, maybe two openings. I didn't know what the appointment term is, you know, how long they served, and do we appoint them as the openings become available, or the organizational meeting in January? I don't have any information.
I would say probably the same on my end, which is why I was asking.
I thought so.
I've usually reappointed them at our January organizational meeting at the
That's what I
town
would-
level.
Okay.
So what, Joyce Thompson and Stephen King for what, chair and co-chair?
And you know, Joyce is in this.
I do. I found out this afternoon, sent her a text. Hopefully she's on that soon. They had suggested sending out a letter to all of the supervisors. I want to say it was January, right? To just a reminder, this is an advisory council. If you have people in mind, please appoint them, or the people that you have
That's
currently.
in the letter now, because
Yeah,
we're
I
gonna
was gonna
make.
say, I typically do, like, my reorg meetings. jump in.
First
Right,
week in
so you're
January.
working on that in December, you know?
January.
So I send it now.
The letter should go out here in November. so it's
Should have been out probably November.
And then what is the term? Do they serve until they're- They don't want to serve any longer,
I
or?
think historically, looking back on information that I found, it's been a 2-year term. But I also think because we've kind of given a facelift to the advisory council, that could be adjusted. When we meet next month, it's something I could kind of gauge.
There's probably some organizing language around the formation of the council, right, that would define the term and the appointment. What's that called? Would it give you?
Bylaws?
standing?
Oh, bylaws of minutes?
Plus, those individuals, I mean, I can tell you, they never report to my board, which it's hard to find people, but maybe on your end, once you get this group together, it could be part of the criteria that they report to the town board
Yes.
once every 6 months, once every 4,
Yeah.
just to do a small, presentation to the town board. We put it on our agendas, and that would help you not to have to come out, but
Or at
also.
least bring that information to the town clerk, to put on track.
That's why we came up with that form that we looked at last month to have, like, they don't have to follow it specifically, but here's the information we're looking to gather from your towns to bring to us for this meeting. And here's what we'd like you to take from this meeting back to your towns. And we're encouraging people to go to town board meetings, have, regular communication with your, local, even if it's just at the library, just gathering, information from your local seniors. So we're working on it, but yes, town board meetings for sure. I think especially now that, community days aren't really happening because it's not warm weather. I think we can definitely make that happen.
Yeah, we don't all have to. So.
Advisory council letters I can work on to send out.
And that would be great, because if short of a job description, if we just had something that, because people say, well, what do I do? How much time does it take? What are the obligations associated with it? So it would be helpful to know. And I will say, those of us who have lunch programs have the benefit that we have speakers coming in from the OFA, at least twice a month. Yeah, so that's helpful, because they're always dispersing news in various papers.
I'm losing people. Are there any questions left for the Office of the Aging? Is there anything from the public? Yes, ma'am.
Okay, two questions. One is, using the opioid flex fund for rental assistance.
He was just sitting in front of you, but go ahead, maybe we can answer, but not as articulately.
Okay, yeah, for rental assistance. That means for rental assistance for people who, have, substance abuse problems.
Yes, and related family, I believe.
There was a presentation last month.
And then something else, the, biospatial. It's, the difference between that and the information that we already have is that it has information from more counties.
So it will compare our counties to state and national trends.
Okay.
And you know, we don't get everything that is available right now, but we get like important stuff like on opioid and substance abuse. We're very well connected with our local EMS. But this platform will provide that comparison and then many other data points that we don't necessarily, get as frequently.
I see.
Or
So,
talk about
so
the
it has information from more places and does automatic comparison. Is that- Okay. And I mean, we can still get the state and national information, but we have to look in different places for each one. And
Right.
This one has it all together.
Correct. Yeah.
Oh, I think it's good.
All right. I'm gonna ask for a motion to adjourn.
Motion.
Second.
All in favor?
Aye.
Thank you, everybody.
Thank you.
I would love to schedule a time to